Greenville seniors, if you have experienced frustrations with your current doctor's office, you're going to want to hear from our next guest. Dr. Erica Savage-Jeter is here from Partners in Primary Care to help explain what exactly a primary care physician is, and if you are an aging adult, why it's so important to establish a good relationship with one. Great to have you here, Doc.
Thank you for having me.
Hey, Doc.
Hi.
And she's from Union County, so you
awesome.
know she's smart and a great doctor.
Exactly.
Yeah.
Let's talk first. Remind people about Partners in Primary Care, because you have places kind of all over our
We
area.
do. So Partners in Primary Care is a senior-focused practice. We have 4 locations in the Greenville area: Greer, Wade Hampton, Greenville, Orchard Park. Everybody knows it's across the street from the post office.
Or I was going to go from TCBY, but yeah, we'll go from the post office.
The other is in the Powerdersville, Easley area, and then we have a center in Anderson. So those are our 4
And you work out of Powerdersville.
I work out of Powerdersville, yes, sir.
What if somebody's sitting out there in their mid to late 60s and saying, well, I'd love to come look around, see what you got? I mean, do you have things in your practices like x-rays and stuff like that?
Absolutely.
Okay.
So, you know, we welcome anyone who wants to know more about Partners in Primary Care to call us, because we would love to schedule a tour, show you around our center, let you meet some of our folks, so you can see what we're all about. But yes, we provide x-ray. We do what most primary care offices do. But yes, we just encourage, if you want to know, just call us and we'll set something up.
Well, explain too for people watching, it's like, I'll only go to the doctor if I'm sick or if I really need something. Why it's important to have a primary care physician?
Well, you know, we view primary care as the way to keep you healthy.
Yeah.
So you can't do that by just visiting the physician when you're sick or visiting your provider when you're sick. So Partners in Primary Care, we encourage regular visits. We encourage longer visits so that we have the ample time to get to know you as a patient, know all the things that affect your health, whether they're medical or social or mental or whatever they may be.
Yeah.
And that we know will determine what your health will be over a period of time. So again, our goal is to keep you healthy. We can't do that if you're just coming to see us when you're sick. We want you to see us often and regularly.
Well, and once you establish a primary physician, if you need surgery and things, you have a referral from an established doctor in your group.
Right, and one of the things about our office is we have this team-based approach, and one of the members of our team is our referral coordinator, and that person is responsible for helping us make appointments to see specialists or to have diagnostic imaging, to let the patient know where to go, what time, what to expect, make sure there aren't any insurance barriers, just eliminating all that worry that may be associated with going to see a specialist or having a diagnostic image done.
And what's something too, because there could be some people out there who's like, well, I've been going to the same group for years. That's great, but how do you know, is that really the right doctor for you? Are you really in a good fit?
Well, it really boils down to that relationship. You know, as a primary care physician, as a person with a primary care physician, you should have that relationship that you can spend the time with your doctor, that you're able to tell your doctor whatever is ailing you. The doctor's interested in not just when you're sick, but when you're well. And so you got to have that relationship, and that comes with time and with trust. But not just that, the office and the facility is just as important in building that relationship. Are there structures in place to help you when you have needs that are not classic medical needs? Is there someone to help you coordinate your visits to specialists? You know, if you have a problem with the cost of your medicines, is there somebody there to help you eliminate that barrier? So it's the provider, yes, that relationship is very important, but the whole network, the framework of the office is just as equally important.
And some good
Shout
tips.
out the locations again.
So with 4 locations, we have one in Greer on Wade Hampton, we have one in Greenville on Orchard Park.
Across from the post office.
Across from the post office.
Sure.
We have one in the Easley, Powerdersville area, Highway 153, and then one in Anderson on Greenville Street. So those are our 4 in our viewing area.
Well, fantastic. And you can go to partnersinprimarycare.com to kind of find the location for you. It'll give you a phone number to each location. And we appreciate you coming on and reminding us about you.
Well, I thank you guys for having us. And I just want to remind you, if you go to the website and there's not a center that's close to you, just call anyway, because we're growing, we're expanding throughout the upstate, so there may be a center coming close to you. So I encourage, if you like the model, to call us.
She may just revealed a little nugget for us to say too. Okay, we'll be following
we hear
you.
good
Thank
things
you,
about
Dr.
you.
Jeter. We
Thank
appreciate
you.
it.